Hi, this is Dr. Michael Banman with Align Life Medical, and I'd like to talk to you about the current medical treatment for arthritis. In the US, there is a treatment cycle that occurs with arthritis or joint pain. Typically, the first thing that's going to happen is the patient's own decision to try some home remedies. These usually include over-the-counter medications for inflammation or pain. It may also include other home remedies like ice, or heat, or stretching, things the patient tries to figure out themselves. When those fail, because the problem is more serious than that, they're going to go to their medical doctor. The medical doctors typically are going to first order an x-ray. After an x-ray, they're typically going to either recommend an injection, maybe they'll recommend some physical therapy, or they're going to send you to an orthopedic doctor. The orthopedic doctor or the primary care doctor will often recommend an injection of cortisone or a steroid of some sort to decrease the inflammation. There are limits on how many steroid injections a person can have per year because of some of the side effects of cortisone and the dangers. So when the cortisone wears off and physical therapy hasn't worked, the doctor is likely to recommend an MRI of the shoulder, knee, or whatever part of the body is still causing pain. An MRI is going to show a lot of things, but they may not always be what the patient's pain is caused by. If a patient has shoulder pain and we get an MRI of the shoulder, the majority of people over the age of 50 are going to have some sort of tear in that shoulder, but that doesn't mean that the tear correlates with the pain the patient is having. So, there is a danger in having an MRI and assuming it's going to show exactly what is wrong with the patient. Once an MRI is taken, the patient can consult with an orthopedic doctor or primary care doctor. If it's an orthopedic and they see there's a tear, they're probably going to recommend surgery, an arthroscopic surgery. This arthroscopic surgery may help if that's actually the cause of the problem, or it may not. Sometimes it helps for a couple years, but then it doesn't last. That's what the patients tell us. After that surgery has worn off, or doesn't work anymore, or never works at all, the last option for the majority of the public is a total joint replacement, or back surgery or neck surgery. The success rate of these surgeries are not as good as most people think. Some people know the success rate for back surgeries and how low it actually is in the long term. The long-term back surgery success rate for a fusion type surgery is very, very low, below 10% for most of these cases. You can even look at professional athletes like Tiger Woods. He's had, I think, 5 back surgeries and he's only in his 40s. So the first surgery didn't fix it and he's continued to have more and more. This is pretty common with the general population in the US today. That's the typical treatment cycle we see. It starts off with some over-the-counter meds and then it goes all the way around until surgeries or multiple surgeries are part of the solution. Not really a solution though, because it doesn't actually fix the problem. Fortunately, there have been some major advances in regenerative medicine, including stem cells, PRP, and a lot of other treatments that can help our patients avoid going through this treatment cycle. Share this if you think it would help friends or family, and if you'd like more information about it, comment below. We'd be happy to answer any questions, and we'll talk to you soon. Thanks.